All this is Dr. Mobeen Sayed from DrBeen.com. Welcome to one more show. So there is so much news today that I thought I'll do one more show and talk about some very interesting thing. So as we talk about Israel, keep an eye on Moderna and Pfizer and Lilly's news as well. And I need your input on that one. That actually surprised me a little bit. So let's look at the news quickly. First of all, this is DrBeen.com. If you would like to buy it, you can go here and go to the pricing and buy that. There is also a link in the description that has a discounted rate on it. Okay, sales plug done. Here is the Israel's news. So Israel is saying that Israel's prime minister says the country's coronavirus vaccination green pass system will be suspended as new daily cases of COVID-19 continue to decline. Now, the context is this. Around 48% of the Israel's 9.4 million people have received 3 doses of the Pfizer-BioNTech vaccine since the countries began rolling out immunization late 2020. Over 72% of the country has received at least 1 dose. So then they say that the prime minister said on Thursday, after meeting with health officials, that Israel's Omicron wave has been broken and that additional reduction in coronavirus restrictions were forthcoming. Do you know this talk or the collection of news that I'm going to present? Actually, every single news points towards countries now, societies now preparing to move forward towards an endemic state or even lesser than endemic state. Although new infections remain high, Israel's health ministry has reported a steady decline in serious cases of COVID-19 since the peak of the country's Omicron wave earlier in February. So that is Israel. I will actually go over their dashboard separately. And as we used to look at the dashboard and by age and vaccination status, we'll look at that. Second part, this is exciting. There's an estimate, and I'm going to show you this. The links are in the description. This is a research projection model. So we also have it in the US. So this is Scenario Modeling Hub. In this modeling, what they're doing is they're doing scenarios to say what will happen in the coming months, how many cases, what is the hospitalization expected, what are the number of deaths expected. And of course, to do those scenarios, they have to figure out what is the current state of immunity. And in that state, they look at people who are immunized by vaccines, mostly vaccines, and then the vaccines that have been waning. I am sure that they add the infectivity as well, but I think they add the infectivity as vaccine and then infection. Still interesting data here. So this is that report that estimated 73% of US now immune to Omicron. Is that enough? So is that enough cannot really be answered. We'll find that out. But 73% estimate, I actually think it is more than that. And the reason I believe it is more than that is we have to consider single infection, that is infection without vaccination as well, in addition to the vaccinations. So here on this little system, what they've done is not a little system, big system, it's just expression. What they've done is that if you go on the left side here, you can click on various kind of numbers you want to see. For example, right now it is in the incident cases, that how many cases are expected. And they have various scenarios. For example, scenario A over here, this chart says optimistic severity of the virus. So they're expecting in this scenario that the virus severity is optimistic and high immune escape. So if that is the situation, what will happen in the coming days? Then scenario B, optimistic severity, low immune escape. If that is the case, what will happen? Pessimistic severity, that is really bad, and high immune escape, that is this, and so on. So they have those. For example, if I go to incident deaths. So this is their projection of the possible cases and then related to them the deaths in the coming days. So this projection, this model is based on a basic understanding of how much in the US we have the immunity. I think that we are more than that. They are also expecting that by March, US will have 80% immunity developed in the society. So this is an interesting one. Then here is Portugal. They are dropping most COVID-19 rules as Omicron is ebbing there as well. So good for Portugal. California, I wanted to share with you this one. So um, California has come up with smarter plan for the next phases of COVID. And my wife was just testing me and she was saying, okay, tell me what does smarter plan acronym means. So I'll read it out to you. So it's a good one. I like the acronym. That's why I'm smiling. So S for shorts. So they start for shorts. I actually think that we should start thinking about, are shorts still valuable? Who are they valuable for? Who must need them for protection? Who can actually be without them as and fine as well? And at least share that information. Let people and their doctors make this decision. But anyways, S stands for shorts. M is for masks, and properly worn masks. So my previous discussion where I said that I believe in masks and folks said, how do you believe in masks? So I agree that the mask, the cloth mask that we wear around, they probably break the straight movement of the air. That's all. It leaks from every place. So I'm talking about the right masks. So anyways, here M for mask. Properly worn masks with good filtration help slow the spread of COVID-19. So that is also in the California plan. Awareness. So this is smarter plan. Awareness. We will continue to stay aware of how COVID-19 is spreading. So thank you very much for doing that. R for readiness. COVID-19 isn't going away, and we need to be ready with the tools, resources, and supplies. There are actually many more tools than the ones that are usually deployed in the US, and we know some of those. T, testing, getting the right type of tests. Interesting. E for education. We'll educate. California will continue to work to keep schools open and children safely in classrooms for in-person instructions. So that is E for education. R for treatment or prescription. Evolving and improving treatments will become increasingly available and critical as a tool to save lives. So if you see here, this is the smarter plan for state of California. You can read the rest. The link is in the description. But it was fun for me to see that they call it smarter plan. Okay, moving on. CDC. CDC is getting ready to change their mask. COVID cases drop, they're changing their mask guidance. So the Center for Disease Control and Prevention is expected as early as next week to loosen its guidance on indoor masking as COVID-19 cases and hospitalizations continue to drop across the country. That's very interesting. Now, for the Moderna, Pfizer, and Lilly, I actually believe that this also has something to do with the way pandemic is closing out or finishing. Moderna says COVID-19 boosters to be ready by August. August. But dicey if Omicron specific needed. Why? So Moderna, I believe, if I remember it correctly, originally when they made the vaccine, they said, we came up with the vaccine within a week or two, meaning very fast. And they have been giving boosters for other variants as well very quickly. We don't even know, and they have been giving us the other flavors. Here they are saying for Omicron will be delayed to August. And of course, the CEO said that the firm is still gathering clinical data to determine whether that vaccine would offer better protection than a new dose of existing jab. So they're still gathering that data. Last month, Moderna began clinical trials for booster dose specifically designed to target Omicron. Initial results from studies in monkeys show that the Omicron specific shot may not offer stronger protection than a new dose of the existing vaccine. So they're saying just use our current vaccines. We believe a booster will be needed. I don't know yet if this is going to be the existing vaccine, Omicron only, or bivalent Omicron. To me, so again, this is my opinion part. I may be totally wrong here. To me, it seems like they're saying clear the current shelf What we have provided to you, sell that out first, and then we'll move forward. But that is just my opinion. I may be wrong. Okay, let's look at the Pfizer. Pfizer and BioNTech Omicron targeted vaccine delayed. Really? Pfizer and BioNTech vaccine also delayed? BioNTech CEO. Delivery of Pfizer and BioNTech SE's vaccine to combat the Omicron COVID-19 variant was delayed by several weeks due to slower than expected data gathering process. Did you see that both companies said the same thing? We are collecting data. BioNTech chief executive Ugur Shahin told Germany's Bild on Thursday, once a vaccine is ready, the company would assess whether it was still needed. If the wave ends, that does not mean it can't begin again. What a pessimistic statement. He told Bild in video interview, adding that BioNTech was in a position to continue creating new vaccines as variants emerged if needed. I really don't see the situation as dramatic anymore, he said, referring to how the coronavirus would develop in future. And you can bet on these companies to figure out quickly what is coming. And that, remember my little cartoon where the Omicron was kicking someone? So you can see that cartoon's results. And here is Lilly. This is important because Omicron is still out there, because it is still causing severe cases in some, and it is still killing some people. So it is not that we can just start celebrating and saying we're done. We are moving in the done towards the done state, but we're not there yet. So please, if you have any friends, whoever around you, any friends, relatives, loved ones, for your own self, keep this drug, bebtelovimab, keep its name with you. This got the emergency authorization. So this is important as well. So again, we know that this is for the non-hospitalized patients. So that means this is for the patients who are at risk, does not matter what age. I think it is from 12 onwards. At risk, for example, they have comorbidities, or because of age, they are at risk. For such patients, outpatient, not the patients who are hospitalized and the patients who are on oxygen therapy. It is for them. So please be aware that Paxlovid, sotrovimab, and bebtelovimab, these are still available. I believe molnupiravir is available as well, but there is hesitation with that. So, but these are the drugs that are available. Write them down somewhere, please. Give it to someone. So this is the discussion. Thank you very much. Please like, subscribe, and share. And if you would like to support this work, you can buy a DrBeen account. I feel shy asking you to buy a DrBeen account, but anyways, you can buy that. There's a discount link in the description, or you can buy me a coffee or be a patron or use PayPal, whichever way you want to support, or you just watch and say like, that is support as well. Thank you very much, and I'll see you at a later time today. At least we have a plan for 6. Dr. Zara Ashkian with us. Rima says, but it's not easily available. So that's the thing. I think the doses are 600,000 for sotrovimab, 600,000 for bebtelovimab, and then Paxlovid. And I believe molnupiravir is even being available and not used. For example, in Wisconsin, it is sitting on the shelves and not being ordered. So yeah, we got to look at the long COVID. So, okay, let me ask you this. So from John's point, one, I created the account on Rumble, maybe for live over there. And Rumble actually has a cost. They have a publisher cost up to $1,000, but I'm not, from their point of view, I'm not that big. So maybe 500 per month or something like that. I also think I'm going to create another account on YouTube to take the lives there. We will continue to discuss studies. For example, there is a vaccine that is coming out for AIDS. For example, there is a genetic modification to the pig heart that was then transplanted in a human being. And so we need to talk about those things. And I think there is going to be a continuity of our discussions. And I think we would separate them out, one lives. And there is a post I have put requesting you to suggest a name. So one channel I'll create for the live, and then this channel would continue doing medical concepts. So thank you very much, and safe day, and I'll see you soon again. Bye bye.